Hello, I'm Shakila. I'm one of the nurse practitioners at Franklin Clinic. Can I please talk with the ED attending to give report on a patient who needs to be transferred from my clinic to the ED? Thank you. Hello, Dr. Kim. This is Shakila, one of the nurse practitioners at the Franklin Clinic. I want to give you a report on this patient who is a potential case of diabetic ketoacidosis. This is a 36 years old male who presented to the clinic today stating that he was having increased GI upset and abdominal pain since Tuesday, which is basically for last 3 days. The patient ambulated into the clinic along with his parents. He is alert and oriented times 4, fatigued and sleepy, yet he is very arousable. Currently, he is having nausea and vomiting, which is happening for about past 3 days. He said he has not taken his insulin for last 3 days due to decreased oral intake. He did not want to become hypoglycemic. He also said that he is experiencing increased thirst, but he cannot keep anything down, so it is kind of a vicious cycle. He denied any headache, blurry vision, diarrhea, bloody vomiting, or urination problems. On my examination, his oral mucosa is dry. He looks a little bit of pale. Pulses are palpable. He is having tachycardia going on. His heart rate is in 110s. Blood pressure is stable. My last reading is saying blood pressure was 121/80 millimeter of mercury. We did a bedside EKG. It showed normal sinus rhythm with large T waves, which representing some electrolyte imbalance. I'm assuming it could be because of his elevated potassium level. We also did a random blood sugar check and it showed greater than 500 milligram per deciliter of glucose. Unfortunately, I do not have a lab in the clinic, so I am not able to do much labs. We were able to do a urine dipstick check. It did show elevated ketones. So a little bit about his past medical history. He was diagnosed with type 1 diabetes mellitus when he was 9 years old. I'm seeing him for last about 2 years. He has usually been well controlled. However, he is been feeling ill as of recently. He just got over bronchitis in last week, where he received a round of antibiotic and some steroids. He got those prescriptions from an urgent care clinic. He stated that he was nervous to take the medicines as he knew steroids can raise his blood glucose level. But I also told him that if he did have bacteria feeds off sugar too. So again, it is kind of a vicious cycle of blood sugar homeostasis. He has no other past medical history, and this is his first potential diagnosis with diabetic ketoacidosis. He does not have any known allergy. Family medical history include father with hypertension. Mother does not have any significant medical histories. He is single, lives at parents' home, works in a superstore as a manager. He does not have any smoking, alcohol intake, or drug use history. He uses short-acting and long-acting insulin for the management of his type 1 diabetes mellitus. So I urged him to let me to call the ER to have them bring over, but he refused. He said he's concerned about financial burden, about calling ambulance. So his parents, who are also his medical power of attorney, they are driving him over since we are just a block away from your hospital. Do you have any question, Dr. Kim? No? Okay, great. If you will have any question, please let me know. You can call me back at this number. So I will send the patient on your way. Thank you so much. Bye.